the air about what plastic surgery actually is, and to inspire you young minds if plastic surgery is a good career choice for all of you. Because when we think of plastic surgery, the common misconception is that it is mostly cosmetic surgery. So I'm here to tell you that it is not. So plastic surgery, is it the right career choice for you? Good morning, and thank you for the introduction, sir. I am Dr. Padmalakshmi, and I'm currently the Assistant Professor in the Department of Plastic Surgery in JIPMA. My areas of interest are microvascular surgery, burns, and trauma and reconstructive surgery. So this is how my talk is going to be. Initially, I might start with a brief history about what plastic surgery is and what exactly is plastic surgery and why I chose to discuss it with you today. Then we'll move on to the different subspecialties of plastic surgery and how we make a difference in patients' lives and how you can become one. What is the path to becoming a plastic surgeon? This is more of my experience and my path to becoming a plastic surgeon. There are some interesting videos of my cases, and I have a disclaimer, I do not practice all the subspecialties of plastic surgery, so there are some pictures that I have downloaded from the internet, but most of them are my clinical pictures. Okay, I told them I won't ask questions, but here the first question. Any shot on what is the first ever reported plastic surgery? Anyone? Come on guys, don't be shy. What was the first ever reported plastic surgery? Exactly, sir. Sir has given the right answer. So, yes. Yeah, it is, in Hindu mythology, it is told that Parvati had kept young Lord Ganesha to guard the gates while she was inside her room. And when Lord Shiva wanted to enter, Ganesh did not grant permission. So in a spite of anger, he chopped his head off. To calm down the distraught Parvati, Lord Shiva decided to transplant the head of whatever was, there. And what he found was a young elephant. So this is a picture of Lord Shiva transplanting a head of a young elephant into a human body. So this is the first ever reported plastic surgery. So let's move on from mythology to the next generation. Okay, there's a question in front of you. The Greeks are thankful to me for practicing my skills in Takshila with steel weapons. My students are trained for 6 years before they can even practice on live humans. And I have also been credited as the first for attributing mosquitoes to malaria and linking spread of plague to rats. Who is this? Come on, this is also linked to plastic surgery. Okay, a very silent and tough crowd to deal. This is Sushruta. So he is credited to be the father of surgery or plastic surgery. And how did he contribute to plastic surgery? So he made templates out of leaves and transposed it to the patient's cheek or forehead. And then he used to reconstruct a patient's nose. So this was termed as Indian rhinoplasty technique, and this technique is still being followed by us, and it has been credited as the Indian rhinoplasty technique. Coming to the modern era, you guys might not be knowing him. He is Sir Harold Gillies. So when World War I was happening, there was a lot of youngsters who went to war and came back with disfigured faces. So Sir Harold Gillies, an ENT surgeon, took interest in those youngsters and decided to focus on facial-maxillary reconstruction. So how did he contribute? So this is a patient with gunshot wound, a young soldier who is returned back from the war, who cannot be even celebrated as a war hero. He can't show his face outside because he has a very gaping hole where his nose used to be. So what Gillies did, he harvested the rib cartilage of the patient and put it in the patient's forehead. I'm sorry, the pointer is not working. If you notice here, there is a rib cartilage which has been implanted into the forehead. So once the cartilage had taken well, he transposed the skin to the nose. So this is once everything has healed, and that is the patient at his 60s post this surgery. So that is the change that Gillies made in that patient's life, and that is why he is credited as the father of modern plastic surgery. So why did I choose to talk about scope of plastic surgery? We are a very poorly understood field, or a misunderstood field is what I would say. I am from a family of doctors. My parents are doctors. But my mother was very unhappy with the choice of me being a plastic surgeon, or me choosing to be a plastic surgeon. The reason is she thought plastic surgery was only tummy tucks, nose jobs, butt jobs. But I am here to say that it is not. And we defy definition. We do not constrain ourselves to one particular area. We are not limited by age, or we are not limited by anatomical area. What I mean is we can operate from head to toe, and we don't limit ourselves to, let's say, like a urologist just to the kidney, or like the neurosurgeon just to the brain. And each surgery that we do is unique. A surgery that I do today, I might not be performing it tomorrow, and it keeps presenting new challenges, and it keeps making us constantly striving for more. And we are creative and challenging. We have an artistic eye to restore form and function, like how Gillies did, especially in reconstructive and here is an MBBS first year. Can we have a show of hands, please? Right. Second years? Okay, third. And final years? You guys are there? Good. Okay, so my journey to, or wanting to become a plastic surgery started in 2007, when I was just like you guys, a first year MBBS student entering Pondicherry Institute of Medical Sciences. He was the director principal in the institute. But how did he inspire me? This is how. So this is a story of 11-year-old Sandeep Kaur from Punjab, Ludhiana. She was actually playing near a wheat crushing machine. The pigtails of her head was caught in the machine, and her face was entirely ripped. Her skin was entirely ripped from her face. So numb by pain, the girl with this was how her face was once it was ripped. She did not even feel pain because the entire skin was ripped. She went to her mother and like, "Mummy, what happened to me?" That is when they realized the severity of the injury. They put the skin and took her to CMC Ludhiana. Little did Dr. Abraham G. Thomas know that he was creating history, because in 1994, this was the first ever face replant that was done in the world. And after 6 months, Sandeep Kaur got discharged and she went home. She didn't stop. All okay? Yeah. So she didn't stop there. Sandeep decided to give back to the community by becoming a nurse. And not anywhere, she decided to follow Dr. Abraham G. Thomas to PIMS to pursue her nursing career. So this is the art, and that is the artist. And this is what had inspired me. I have met her a few times, but I never understood what it was until I went and read up on her. And that is what had inspired me to become a plastic surgeon. Dr. Abraham G. Thomas is 76 years old, and he's still practicing in Kerala. And Sandeep Kaur is a registered nurse practitioner in New Zealand. She's happily married with 2 children. So, coming to what are the subspecialties of plastic surgery? So, is it just a six-pack abs creation? I am here to say no. We do that as well. That is the difference that we make in patient's life. So a little bit more in detail, cosmetic surgery can be surgical or non-surgical. And reconstructive surgeries, like any, I think in your pathology you will be knowing tumor, trauma, infection, we add congenital, burns, and transplant. So that is how you can classify reconstructive surgeries. Okay, diving right into reconstructive surgeries. This picture is kind of a favorite of mine. Anybody want to tell me what it is? It's a cleft lip, probably associated with a cleft palate, yes. So these children present to us very often and it is very correctable, very much correctable by surgery. So the first time in my residency in first year, when I was in a unit which predominantly did cleft cases, I saw this, I'm like, wow, that is a very big defect. How are we gonna correct it? That was, I mean, you guys must be thinking, how are we gonna correct this? So that was the same question that I had in my first year of residency. Fast forward to post-surgery, the defect had vanished, and I was truly awestruck, but that was not the end. Once the child came out of anesthesia, the child gave a beautiful smile, and that is the most prettiest smile that I have ever seen. So that is the moment that sealed the deal for me when I was thinking, why did I choose plastic surgery? And that is when I thought, yes, this is the right decision that I have made to become a plastic surgeon. So this is a happy parent who had sent us the 8th month birthday picture of the child. Want to find the, can anybody spot the anomaly in? Yes, this is something that we call a congenital torn earlobe. We all know that torn earlobes can happen because as girls we tend to wear heavy earrings, but this is something that the child was born with. And believe me or not, this child was very upset that she was not able to wear earrings. So that is the complaints with which the parents brought her to us. So that is the picture post-surgery. Now the child happily came to us for a ear piercing. We were happy to do the ear piercing for the child, and now she is very content with her ears. This is another picture. If you notice here, this is a hand of the child which is bent when the child was born, and this is post-correction. This can make a significant impact in the child's life because a bent hand is almost difficult to use. So we have to straighten the hand to make it usable. Okay, now we have finished congenital. Let's jump into tumors. Can you see the picture? It is glaring to our faces. If it is so glaring to us, imagine how it would have been for the patient herself. This patient is a young 34-year-old woman who could not tolerate the smell that was coming out of that lesion so much that she could not eat, and she was throwing up continuously because of that smell. The vomiting was not because of the tumor per se, it was because of the foul smell. So we are a team working people. So in this case, there was a surgical oncologist who was also involved, and people who know cancer, they know that they have to excise it in a much more beyond the lesion itself. So when the surgical oncologist excised it, that was the defect. So that is a full thickness defect of the buccal mucosa that is inside the mouth and the cheek which is outside the mouth. So how did I reconstruct it? So that is how it is done. So this piece of skin here that you see is not just skin. That is something that we call the flap. So it is a piece of flesh that is taken from the thigh along with its blood supply, and it is anastomosed to the neck vessels. Yeah. So if you can see here, this is the flap vessel which is being anastomosed to the facial artery. Guys, you know facial artery? So this is being done to the facial artery. If you see here, that is the internal jugular vein. So the venous drainage of the flap, we are attaching it to the internal jugular vein. So this is what I specialize in. So this is microsurgery, and that is 20x magnification. This young chap, a 29-year-old boy from Kerala, has come to us with repeated swellings on the arm. They tried removing it, but it just kept coming back. So it was diagnosed to be a sarcoma and handed over to the surgical oncologist, who excised the lesion completely and left us with that raw area. So this is what I was talking about. That is the anterolateral thigh flap, and that thin string that you are seeing is the blood supply to that paddle, which is the lateral circumflex femoral artery, and we had anastomosed it to the brachial artery on the arm. So if you see there, that is how the end result was, but it doesn't end there. This is the patient 3 months later for a follow-up. Knowingly or unknowingly, I had created a nice bicep for the patient. So So he has no range of movement restriction. He has recovered completely. That is the outcome that we got. Okay, now that tumor is over, coming to trauma. With the advent of road traffic accidents, trauma is a major chunk of a plastic surgeon's practice. So this young boy was hit by another vehicle, fallen down on the road. If you see here, apart from the other injuries, there is a big defect at the root of the nose. There is no skin that I can suture back, and underlying nasal bone was also defective. So we followed, I would say, Sushruta and Gillies. It was like a mixture. And what we did was we utilized the uninjured area at the forehead. We rotated it to cover the defect. Post-surgery, the patient had almost no discernible defect because that piece of flap had provided the contour for the patient. This is also another young man who went in a Tata Ace along with his friends, a college student to be exact, went in a Tata Ace for some social work. The Tata Ace toppled. He lost 2 of his friends in that accident. He presented to us with a shattered earlobe. So what shattered external ear, sorry. So what I usually tell my residents is, in a trauma, plastic surgery is usually like fitting a puzzle piece. You find the right piece and fit it to the right defect. So that is it. What we did here. We had done a debridement, fit the cartilage where it fit, and closed the skin. So the third picture is when he got discharged. The fourth is 3 months later. So this is 6 months post-op. I have put the right ear and left ear for a reason. Can you guys find which ear was the trauma ear? It's the left ear. The right ear is the normal ear. So both the ears were almost near normal with very minimal scarring in the left ear. Can you see what is happening here? Yes? We can, in short, say his face is smashed. Every bone in his face is broken. Mandible, maxilla, zygoma, orbit, you name it, it is fractured. Yeah. So this was a patient who went against a four-wheeler, went and rammed his vehicle under the influence of alcohol into a four-wheeler, got his entire face smashed. Thank God for him. He did not suffer any intracerebral or neurosurgical injuries. So this was an 8-hour-long surgery, if I remember right, and that was a number of plates that we had to put in. I think it was something closer to 10 to 12 plates we had put in. Incidentally, we had taken this CT, for something else we had taken the CT, but then that is when we realized, have we created the Terminator? Yeah, it was close enough. We had that many plates on him, but that is what meant that he had a near normal life. Okay, this is kind of an awareness thing that I'm going to create for all you boys out there and some girls out here. Kindly do not clean your bikes by putting it on a central stand and putting the first gear, and don't try to clean the chains yourself. Be safe, because this is what can happen if you attempt to do it yourself and your fingers get pulled. So no, but this is not a young man. This is a child. This is a 2-year-old child who was playing next to a bike which was parked for cleaning. So playfully, he went and put his hands between the wheel and it got caught between the spokes. The parents, distraught parents, brought the child to us with a transmetacarpal amputation of all 4 fingers. So if you can see here, the index, the middle, the ring, the little, all of them avulsed. So what did we do? We decided to go ahead with replantation. A 2-year-old's vessels are even smaller than a 1 millimeter diameter, which is even thinner than your hair. So we went ahead, and this is what we were able to provide the child with. But not over yet. Unfortunately, this child is still admitted under me in JIPMER. Unfortunately, only the ring finger survived. I could not replant the little finger. Only the ring survived. The middle and the index finger went into gangrene because it was too contaminated, it got infected. And right now, as we speak, the patient is undergoing surgery to remove the middle and the index finger. But at least we were able to give 1 finger so that the child can use it as a post. Coming to infections. this is a 50-year-old lady. She decided to walk to a temple barefoot. Mistake number 1. Okay, walking done. So once you walk for a long distance, what happens? What happens, guys? You walk for a long distance or a long duration. What happens? Your leg pains. Okay. So what she should have done, she should have stuck with one home remedy. But no. One person, one well-wisher who was next to her said Iodex. Okay, chalo, let's get one bottle of Iodex, put it all over her leg. Done. The next person decided, no, Iodex is very much home remedy. Let's go Volini spray. Volini spray, one bottle, gali. Adutha, no, how can you do that? You're going to a temple. Mangalakarama, you should put manjal and vettala. Let us do that and tie it up to your leg. That also done. Second day, next day, she opens it to find blebs, much more swelling and severe excruciating pain. So she had developed a soft tissue infection and she presented to us, and post debridement, this is all that was left behind, and post reconstruction, that is what we could give her. She had to undergo repeated debridements and repeated negative pressure wound therapy, or something that we can term as suction therapy, and we could graft her leg without any flaps. And that is her, yet again, walking into my OPD without chappal, after telling her so many times. But yes, she was very happy, and a happy patient, happy customer, happy doctor. Burns, yes. Another major part of our practice is burns. Burns is a leading cause of mortality in the country. And I would say, God forbid, if the patient survives, she or he will also face a lot of physical, social, and mental morbidity as well, because it is very difficult to face the world with so much scars. So this patient had presented to us with a gas stove burst injury. She had 45% thermal burn, and this is her 3 months later, happily walking into our OPD with bare minimum scars. This is another young child. Children are very inquisitive. They like to see what is kept out of reach. So this little girl decided to pull a cup of hot milk onto her, and she had sustained burns to her chest and to her face. Yes, very sad, I know, but this is what makes us happy. She was very, we feel very happy when they go from our ward happy, playful, and whatnot. Like I said, it is not just me. Whatever I have done here, whatever I have showed you here, it is not just me. We are a team, and this is the healing team, my staff in the burns ward, who make the difference happen. If you see there, it includes professors, residents, staff nurses, even the cleaning ladies are involved, because they are very important to keep the ward clean after every patient, keep the bed clean after every patient. So whatever we do, it is not a one-man show, it is a teamwork. Did you guys know that plastic surgeons could do transplants? Have you heard that plastic surgeons have done transplants? Okay. So yes, we can do transplants, and I had the privilege of assisting in 2. This was the first transplant that I had assisted. So when I had joined, JIPMER had already completed 1 successful transplant. This was the second transplant of JIPMER. So let us name him Mr. S. So Mr. S came to us with bilateral upper limb amputation and wanted a transplant. And at that time, I was the only Tamil-speaking resident in the department. So I had the opportunity, or I would say blessing, to talk to them. So I asked them, dude, why do you want a transplant when there is so much, prosthetics available? These days, prosthetics are so advanced that you don't need a transplant per se. So I asked them. So his story is what I'm going to tell you now. So he said, can most of you understand Tamil? Okay. So he said, madam, என் வைஃப் வந்து டெலிவரிக்கு ஊருக்கு போனாங்க. அப்போ நான் வரப்போகிற குழந்தைக்காக I worked a little bit more. So tipper லாரியில் நான் வேலை பார்த்துட்டு இருந்தப்போ ஓவர் டைம் கையை வந்து நான் வச்சுருந்தேன், கவனிக்காமல் டிப்பர் லாரியோட ஷட்டரை க்ளோஸ் பண்ணிட்டாங்க. ஸோ அதில் தான் என் கை வந்து துண்டாயிடுச்சு. என் குழந்தை அதுக்கப்புறம் பிறந்தான். என் குழந்தைய நான் தொட்டு பார்த்தது கிடையாது, தூக்குனது கிடையாது, அவனோட அந்த டச் வந்து எனக்கு எப்படி இருக்கும்னு தெரியாது. ஸோ அவனை தொட்டால் எப்படி இருக்கும், அவன் கையை பிடிச்சி அவனை ஸ்கூலுக்கு கூட்டிகிட்டு போகணும். இது ஒரு ரீசனுக்காக தான் எனக்கு டிரான்ஸ்பிளான்ட் வேணும். பிகாஸ் டிரான்ஸ்பிளான்ட் இஸ் அ வெரி மார்பிட் சர்ஜரி ஐ வுட் சே, பிகாஸ் you have to suppress the immunity, and then with that comes a lot of immune complications, and with the medications of immunosuppressants you get uncontrolled sugars. It's a lot, actually speaking. So I really wanted to know if they were clear enough on their reason to why they wanted the transplant, and so that is what he said. The hand came from Bangalore, Narayana Hridayalaya. One team went to Narayana Hridayalaya to harvest, and we were staying here to prep the patient. It took us about, if I remember right, it must be 24 or 36 hours for the surgery. We successfully finished the surgery, and the well-motivated Mr. S stood up and decided that he will walk around on day 3 or day 4 of surgery. And he was such a well-motivated patient. He walked out of the ward by 3 to 4 months after the transplant. But it doesn't end there. Yeah, and his post-operative period was not any easy. A very stormy post-operative period, both for him and for us who were monitoring the patient. But this is something that he sent to me recently. That is him. It's been 6 years since we've done the transplant. Both husband and wife, they run a very busy business, okay? You cannot catch hold of them. Even today, if they come to the OPD, I'm like, Mr. S, can you come to my room? I would like to talk to you. He's like, Madam, வீட்டில் பிஸ்னஸை விட்டுட்டு வந்துருக்குறோம், இப்போ நாங்கள் வந்தோன்னா கொஞ்சம் கஷ்டம், அதனால் நாங்கள் வீட்டுக்கு போயிடுறோம். That's all. They come, they get their medications, and they run away. But this is what he can do now after 6 years. And he got what he wanted. That is, hold his son's hand and take him to school. So this is the difference that a plastic surgeon makes in a patient's and his or her family life. So yes, we do other transplants as well, but not in the country. We have not done face transplant or abdominal transplant yet. Face transplant, if you remember at the beginning of my talk, I told in 1994, the doctor who inspired me, Dr. Abraham G. Thomas, had done a face replant. Following it, keeping that as basis, in 2010, the first full face transplant was done in Spain. As Indians, we were forefathers to that face transplant. So, yeah. But does face transplant mean that? Can I transplant Brad Pitt's face into somebody else's? Or can I transplant a six-pack abdomen into a pot belly? That's not it. This is what it is. That is a fully disfigured face with multiple flaps being done, and that is his face after the transplant. And that is a almost eviscerated abdomen in whom an abdominal transplant is done. No, these cases were not done by us. This is taken from articles. Yeah, my talk on cosmetic surgery is going to be very small, 2 slides only. Cosmetic surgery, when it is surgical, it can be breast augmentation or breast reduction. Gynecomastia surgery, patients who undergo massive weight loss, who have hanging skin paddles like that, we correct that into near normal. Face lifts to look prettier. Nose jobs, yes, rhinoplasty. Or even lip reduction surgeries. So the non-surgical, like everyone knows, Botox, fillers, threads, lasers, all the entire shebang that you all already know about plastic surgery and cosmetics, that is what it is in cosmetic non-surgical. So, coming back to my question. What is plastic surgery? Is it that? Or is it that? Yeah, so what plastic surgery actually is that we are a highly specialized and a versatile and dynamic field. And we blend artistry with scientific precision. Every single one of our flaps are measured, pre-planned, and planned and planned and planned. And we make a profound difference in patients' lives, not just the patient, their family members too. So how do you become one? So you guys are all MBBS students, so this must be a question right now for some of you, if not all. How do you become a plastic surgeon? So you start your MBBS, obviously. So the select few of you who might have an interest in surgical field can go ahead and pursue MS General Surgery or DNB General Surgery, which is for 3 years, followed by a super specialization in MCH or DRNB plastic surgery. Illa, I don't want to do MS. Abdina. There is a 6 years blended course which is there only in select institutes of the country. So you can go ahead after MBBS with a direct 6 years MCH or a DNB course. Once you finish there, you can do fellowships. So what do the fellowships do? So after the 3 years of toiling, you will get an overall picture of what is plastic surgery. So you'll be like, you'll be able to do everything. If you want to specialize in one particular thing, one particular subspecialty that I spoke about, you can choose to do fellowships, which will last for a year or 6 months. So it's 5.5 years of MBBS, 3 years of MS, 3 years of MCH, and 6 months of fellowship. Yes, it takes that long to get here. But if you ask me today, was that journey, I started my MBBS in 2007. You can do the math. If you ask me if that journey was worth it, I would totally go for it. It was totally worth it. But how do you choose the specialty? Already MCH plastic surgery mudichachu. Why? How do you choose the subspecialty? If you want an exciting and unpredictable lifestyle, you can go for trauma, burns, microvascular, or reconstructive surgery. If you're an adrenaline junkie, exciting, unpredictable works for you, go for it. On the other hand, if you want a controlled lifestyle, you can go for cosmetic and aesthetic surgery. You can run a typical office hour practice, 8 to 4. Come back, chillax at home, follow your passions, travel around, do everything. If you are a very academia oriented person, you want to do research, regenerative medicine is for you. It is an upcoming field and you can choose that. Guess what I chose? Exactly. I am an adrenaline junkie, guilty as found. I chose to be a trauma reconstructive and microvascular surgeon. And my life is very exciting as much as it is unpredictable. So this was the turning point when I chose to be a microvascular surgeon. Do you see this earthworm that is here? That is not an earthworm. That is a vein that we had to anastomose for a finger. The guy had a cut finger and a cut vessel. So we had to put this there for the blood supply to be restored. If you see here, this vessel is just about 1 millimeter thick. So once I did the anastomosis, that is what I got, a pulsating vessel. And this was my first ever microvascular anastomosis that I did in my life. And this is when I decided, chalo, let us do the exciting and unpredictable. So thank you very much. And I'm going to end my slide with this picture. So this picture is yet another case of mine. It's a landmark case of mine. It put me on newspapers. So that is a 5 kilogram tumor that is lying there. That is the very exhausted, excited, unpredictable, but super exhausted me standing there after 6 hours of surgery. This lady had come to Jharkhand, to us, to Pondicherry, to get operated because most of them got scared with the load of the tumor. She could not lie down on her back. Her history was that she is not able to lie down on the back. If I had removed the tumor adequately enough, she was very happy. So that is us, that is me, that is my 5 kg tumor, and that is a very exhausted me. Thank you, Arunai Medical College team, for the opportunity. If you have any questions, you can reach me in any of the avenues that I have mentioned here. Thank you so much. Over to the chair people.
We thank you, ma'am, for unraveling the prospective future and true essence of plastic surgery. We now invite Dr. Bharat Kumar Singh, sir, to offer his insights.
Very inspiring talk to the young minds. Definitely some of the minds here in the hall will definitely be inspired by her talk. At least one mind, it's definitely a change in the field, especially the girls' minds, whether to pursue the general surgery. That is a big decision. This was a nice talk, ma'am. Any questions can be from the gathering?
I'm happy to take any questions.
Any simple doubts, silly doubts, anything you can ask. No one is going to judge you here.
Same question. I mean, same things that I've told you, you're telling back, yeah. Anything, guys, anything. Thank you.